At a section of the Swami Magazine enclave in the Ashanti region of Ghana, known as Abawa Ruth, auto mechanic Clement Zuma drains used engine oil. With the oil at the brim, Clement can't move it without getting his fingers soiled. The oil is responsible for his stained palms. Clement, who came here a decade ago, has been eating with these hands, sometimes washed, sometimes left to chaperone his meals. Though Christopher would like to don long sleeves to work to limit skin contact with both dirt and oil, he hasn't been spared the discomfort of dirty oil on his skin. Engine oil is a type of lubricant used in automobiles to reduce friction, heat and wear among mechanical parts that are in contact. These oils are chiefly petroleum-based or synthetic oils with some additives for improved performance. As a result of its continuous use, the oils become contaminated and therefore must be replaced with fresh engine oil, as the used engine oil is no longer functional. Waste oil has been found to contain lead, zinc, arsenic, chromium, cadmium and sulfur. These metals have been found to be harmful to the body. The major organs can be in serious danger when exposed to these metals. Professor Fred Boadu is with the Duke University.
First, it can cause cancer. 2, it can cause hypertension. 3, it can cause miscarriages in pregnant women. 4, it causes erectile dysfunction in men, and it's very, very, very potent in that aspect. That is well scientifically proven that can cause erectile dysfunction. And 2, also, it causes diminished learning abilities in children.
Improper disposal of waste can lead to heavy metals finding their way into soil, surface water and groundwater. Unfortunately, pouring used oil on the ground is commonplace, a practice thought to strengthen the soil. As part of efforts to identify and address some public health concerns in Africa, the Civil Engineering Department of Duke University in the United States of America have partnered the Kwame Nkrumah University of Science and Technology Ghana to understand these practices in order to help the auto mechanics at Swami Magazine to deal with them. Professor Fred Boadu, who is leading the team, has previously researched the presence of these heavy metals in the blood of the auto mechanics, where heavy levels of these metals were detected.
Duke University has a very good program, what we call the BAS connection, where they allow people to do research in various areas. So I did have a grant from BAS connection, and I came down to look at the heavy metal level contents in the auto mechanics. So we took their fingernails, toenails and hair, and we analyzed for these metals. And we did find out that, we found out that depending on the number of years that you work as a mechanic, you have higher metals in your system. So those at younger, smaller years of working here had lower metal levels, and those with higher years of working, like over 12 years, have very high levels of metals in them. So that was where the whole thing started, that we thought that the metals has a lot to do with the retention in your system. In addition, we also measure the blood pressure, and we realized that the higher the metal level content in your system, the higher the blood pressure measurement. So that prompted us to come and do more of health education for the mechanics.
The students are happy with the interaction with the auto mechanics.
And one thing that I've noticed is that I think a lot of them have actually known to some extent that there are some problems that can be caused by the motor oil and not wearing protective equipment. But I feel like we're going one step further and helping them further understand the effects that can be caused by this motor oil and the heavy metals. For example, I think a lot of them don't know about exactly all of the problems that can be caused, such as cancer and liver damage, and really also the different protective measures that can be taken to help prevent the exposure to the heavy metals.
And I think when we first got here, I was a little worried about being able to relate to each other, especially with the language barrier between some of us and some of the mechanics. But I think I've really been shocked at just how easily we get along, how fun it is actually to interact with them and even joke around, how much we've been able to come together and work towards solutions, because obviously we didn't come in with all the answers. We don't know how everything works here, and so it's been really great.
And one of the things that I've learned is just how important the role of mechanics are here in Ghana. It's been really amazing to see all the work that they do, and kind of an honor to be able to work with them and hear their ideas.
And my observations with the site here is that the first time I came here, I was very shocked at the working conditions of the mechanics here. I would never have assumed that people would be working without gloves or the proper protection. And I think it's a really good thing that we're starting out with this public education as a first step to raise awareness of this issue.
So here in Ghana, I didn't know what to expect at first coming here. Some of the mechanics we talked to, I wasn't sure how receptive they would be to our education that we're giving them. But I was very surprised because everyone we talked to was very receptive and very excited to implement some of the solutions we suggested to them.
So what I've observed about them is whenever we are talking about the motor oils, whenever we bring it to the Ghanaian settings, for example, talking about boreholes or mango trees or how we are able to use the oil to make roads, they just keep quiet and retrospect, and that is very intriguing. So I think if we're able to bring the effects down to their level more and talk about things more culturally to them, they'll just keep quiet every single time and they'll be able to imbibe whatever we are teaching them, and I find that very intriguing and exciting.
Okay. Well, one thing I've noticed about the mechanics that we speak to is that they are always ready to learn. They're excited about what we bring them, and they actually wish that we even had materials that we could bring them, so they start inculcating all that we've been talking about into their daily activities.
So I feel like this education has opened their eyes, and that I'm hoping that they will be able to abide by the simple preventive and precautionary measures that we've asked them to.
The manager of the area, Kennedy Ayinde, is grateful for the intervention.
Particulars na wo mu no echire no emaye yare ba mu ba na mu maye nchechire mu no aboa yen se ene se ehwe de ti oye ediguo.
Ghana's Ministry of Health can also take it up to educate these auto mechanics on proper handling of used engine oil to ensure the health of both humans and the environment.